Good day, everyone, and welcome to Stabilis YouTube channel. I'm Sister Sulfelo Padime, and I'm a registered nurse at Stabilis Treatment Center. Today's topic will be on alcohol withdrawals. It has come to my attention that most of the time, when explaining detox regime or medication for alcohol withdrawals to my patients, the most commonly asked question is, what are withdrawals? Hence, I chose the topic at hand in the hope of shedding some light as to what to expect and the symptoms associated with alcohol withdrawals. So by the end of this video, you should have a better understanding of the definition of alcohol withdrawal, the physical and mental symptoms associated with it, and the different treatment methods or plans available for optimum recovery. Bear in mind that I'm not referring to a single night of overindulgence or just a casual weekend of heavy drinking, because in such instances, it is very unlikely or very rare that one will experience withdrawal symptoms. I'm referring to heavy drinking for a significant amount of time where one experiences recurrent episodes of alcohol withdrawals. Now, what do we mean by alcohol withdrawal? Well, these are physical and mental symptoms that one will experience when the sudden cessation or a serious reduction of alcohol consumption. What this means is that as an individual where you've been drinking heavily for like weeks and months and years, and you abruptly or just suddenly cease or stop drinking, or you seriously cut down on your drinking, you might experience certain physical and mental symptoms, and these symptoms are called withdrawals. So one might question as to what are the causes of withdrawal. Well, alcohol has a depressive effect on your system. So it slows down brain function and changes the way our nerves communicate with each other. Now, the breakdown in this communication may lead to alcohol withdrawals. Okay, now that we have covered the definition of alcohol withdrawal, we will now dwell a little bit into the physical and mental symptoms associated with alcohol withdrawals. Withdrawals are divided into 3 stages. The first stage usually occurs within 8 hours after your last drink. Some of the symptoms are interlinked, and you will understand why as I explain further. The first common symptoms are headaches, dehydration, and thirst. Now, besides the fact that alcohol causes dilatation of blood vessels, which in turn will increase pressure in the brain, which might cause headaches, we know that alcohol is a diuretic. What this means is that it simply increases urination. So the more you urinate, the more you lose important fluids, minerals, and vitamins, which will lead to our next symptom, which is dehydration. Now, the more dehydrated you get will lead to our other symptoms, which is thirst. The more dehydrated you get, the more thirsty you get. Hence, I say the symptoms are interlinked. Now we go to the second stage of withdrawal. This occurs within 24 hours after your last drink. You might also experience symptoms such as nausea and vomiting, loss of appetite, and stomach pains. Remember, during alcohol consumption, you produce a lot of acid in your stomach, and as well, it may prevent your stomach from emptying, which will cause nausea and might induce vomiting. You may also experience fatigue or tiredness. During alcohol consumption, there's a large amount of blood flowing to the areas of the pancreas, which might increase insulin and then will lead to low blood sugar levels. This in turn will cause fatigue as well as tiredness. Now, the most important one is tremors, because those are the most common ones during withdrawals, because you'll be feeling shaky. What happens is whenever you drink, your central nervous system becomes hyperactive, which will lead to tremors because now there's a high brain activity at the moment. And tachycardia, anxiousness, irritability, mood swings, depression. Now, with hypertension and tachycardia, again, these are interlinked because we know that alcohol increases blood flow, now which will in turn causes the heart to work harder and pump faster. Now this in turn increases your blood pressure and will increase your heart rate as well. Now we know that during this fluctuation of blood sugar levels as you withdraw, your blood sugar fluctuates constantly, more and more. Now with this fluctuation in sugar levels, this will lead to mood swings. With mood swings comes anxiousness, irritability, and then depression at some point. And then the third stage of alcohol withdrawal. This occurs after about 72 hours after your last drink. Now, these are possible seizures and hallucination. Remember, with seizures, whenever you withdraw, every time you withdraw, you cause irritation to the brain. Now, the more episodes of withdrawals you have, the more you irritate your brain and the more prone you are to seizures. Now, hallucinations. When you drink, there's an increase in dopamine, and we know dopamine is responsible for feelings of pleasure, satisfaction, and motivation. Now, once you start detoxing 72 hours, now the alcohol is out, meaning now your dopamine decreases. Hence, you will start having depression because now that sense of pleasure, that sense of satisfaction or motivation is no longer there. Now you feel depressed, you feel hopeless, you feel emotional, and so on and so forth. Now with hallucination and confusion, we know that you will experience a dip or decrease in serotonin. Serotonin helps your brain cells communicate with each other. Now, if there's a communication breakdown within our brain cells, this might lead to confusion, to hallucination, to delirium. These are the most dangerous symptoms that one might experience. Now, bear in mind that when you are home, please seek medical attention, as we know that withdrawals can be life-threatening, so don't take them lightly. It is very, very important that you make sure that you visit your doctor or you seek medical help. And now we finally discuss the treatment options or treatment for withdrawals. It is very, very important that you eat. So diet plays a vital role in recovery. Due to a drop in your blood sugar levels, you must increase your carbohydrates. Like carbs such as crackers and bread. It is very important that you eat those so that you boost or you normalize or you stabilize your blood sugar. You must also increase your vitamins, your minerals. Eat food rich in protein, fats, healthy fats like eggs, fish, nuts, all of that. This will help to replenish all the depleted nutrients. So it's very, very vital that you eat. When you are during detox, what we normally do, we add to your regime folic acid, thiamine, anything that might help, magnesium, even if, so that we get to replenish whatever that is lost, because you will need all the nutrients, all the minerals that you need to recover. Now, pain medication also is very important. Make sure that use non-steroidal anti-inflammatory such as ibuprofen, which is the most common one, most effective. Stay away from codeine. Use strictly ibuprofen because it will help with aches and headaches and all of those things. Pain management, very, very important, because you will experience headaches, you will experience muscle aches, your body is still trying to recover. So it's important that you take your medication as needed. As needed. Now you avoid alcohol, then you drink lots and lots of water. Remember, your body's dehydrated. Drink lots of water, drink energy drinks, rehydrate, try to hydrate yourself as much as possible. because now you are replacing all those minerals back. All those electrolytes that you lost, you need to replace them. Your body needs water, is highly dehydrated. We would also advise you exercise. Exercise promotes healthy blood flow, which in turn aids in recovery. So the more you exercise, the more, the chances of your body recovering. Take it slow, but try and, exercise as much as possible. Some might even consider like meditation. Meditation helps a lot. Meditation clears your mind. You focus more, it calms you down. So it's very important. So these are just the basic treatments. Other than that, please seek medical advice. That will be all for today. Hope you found this video helpful. Please don't forget to like, share, and subscribe. Thank you. Bye.